Hey everyone, and welcome back for another deep dive.
Always a pleasure.
So today we're going to be taking a look at something pretty fundamental,
Yeah.
breathing, you know,
Mm-hmm.
oxygenation, how we get that good old O2 into our systems.
It's the stuff of life.
It really is.
Yeah.
So we've got a whole stack of research here all about oxygenation.
Awesome.
Really looking forward to diving into this. And
Should be fun.
yeah, I was thinking about this
Yeah.
in terms of, we've done deep dives on all kinds of topics, but this one seems so basic and yet
It really is.
it's so essential.
Foundational. You
Yeah.
know, you can't live without it.
No, you can't. And I think that's what's so fascinating about it,
Heck yeah.
is that we do it all day, every day, and we don't even really think about it.
Yeah, you don't have to,
No.
It just happens automatically.
Exactly. But I think there's so much to learn and so much to appreciate about this process that we take for granted.
Oh, absolutely.
Really?
Layers and layers of complexity.
Yeah. Yeah. I mean, where do we even begin with this?
Well, I think we start with the basics.
Okay.
The mechanics of breathing.
Yeah.
Inspiration and expiration.
Okay. So
What's actually happening in our bodies when we take a breath.
like when I breathe in, my chest rises.
Right.
Like what is going on there?
Well, it's all about changes in pressure and muscle action.
Okay.
You've got this big muscle underneath your lungs called the diaphragm.
Okay.
And when you breathe in, or as doctors call it, inspiration, that diaphragm contracts and flattens,
Okay.
which increases the space in your chest cavity.
Makes sense.
And because nature abhors a vacuum, air rushes in to fill that space.
So it's almost like you're creating a vacuum
You are.
and the air has to come in to fill it.
Exactly.
And then when I breathe out, what happens?
Well, that's expiration.
Okay.
The diaphragm relaxes and moves back up, decreasing the space in your chest cavity.
So it's like a pump
It is a pump, essentially,
pushing the air out.
and that forces the air out of your lungs.
So simple, yet so complex.
Isn't it amazing?
It really is. Okay, so we've got this, in and out.
The rhythm of life.
But
Yeah.
our sources mention something called a hypoxic drive.
Oh, yes.
What is that exactly?
Well, it's kind of like a backup system for breathing.
Okay.
See, normally our body regulates breathing based on the levels of carbon dioxide in the blood.
Okay.
But when oxygen levels get really low, like at high altitudes or in certain medical conditions,
Right.
this hypoxic drive kicks in.
Okay.
It's like a safety mechanism.
So my body's like, wait a minute, we need more oxygen here.
Exactly.
Let's get this going.
Special sensors in the arteries detect that low oxygen level
Got it.
and trigger faster breathing to compensate.
Interesting. So it's like a built-in emergency response system for when things get really dire.
Precisely.
That's pretty cool. Now, speaking of taking in air,
Yeah.
we keep seeing this term inspiratory reserve volume.
Okay. Yeah.
So is that basically like extra lung capacity? Like I've got my normal breath,
Got it.
but then I've got this reserve.
It's like the reserve tank in your car.
Okay.
It's the maximum amount of air you could inhale beyond a normal breath.
Gotcha.
Think of it like blowing up a balloon.
Okay.
You take a regular breath,
Yeah.
then you can force even more air in.
Right.
That extra bit is your inspiratory reserve volume.
Interesting. So it's like having this hidden reserve for those times when you need to take in a lot of air.
Exactly, like when you're exercising or singing.
Yeah, that makes sense.
Yeah,
And I'm guessing there's a similar thing for exhaling, like an expiratory reserve volume.
you're absolutely right.
It's the amount of air you can forcefully exhale after a normal breath.
Right, it's like squeezing all the air out of that balloon.
So our lungs are capable of so much more than we realize,
Oh, definitely.
which is using a fraction of their potential.
And that's just the beginning.
Okay, well, let's talk about the lungs themselves then.
Okay, sure.
So they're described as being pink and spongy and flexible.
Right.
Why is that so important?
Well, imagine a brand new sponge,
Yeah.
soft and airy,
Okay.
able to soak up a lot of water.
Okay, I like where this is going.
Healthy lungs are similar.
Okay.
They're elastic. They can easily expand and contract to take in oxygen and release carbon dioxide.
It's like they're breathing themselves.
In a way, yes.
Okay.
But damaged lungs, often from things like smoking, they lose that elasticity.
Right.
They become stiff like a dried out sponge,
Okay.
and they just can't do their job as well.
So what happens when our lungs can't work efficiently?
Well, think about trying to breathe through a straw.
Okay.
You're going to get less air in,
Right.
less air out. Your body has to work harder.
Okay.
And over time, that can lead to serious health problems,
Right.
impacting your energy levels, organ function,
The whole 9 yards.
the whole 9
Makes
yards.
you really appreciate those healthy lungs.
Absolutely.
Okay, so we've got this oxygen-rich air in our lungs now.
Right.
How does it actually get to the rest of the body? That's where the heart comes in, right?
You got it. The heart is the engine of our circulatory system,
Okay.
a powerful pump that keeps that oxygen-rich blood moving throughout the body.
So it's not just about love songs and Valentine's Day.
It's much more than that.
Okay, so how does this all work together?
Well, imagine the circulatory system as a complex network of highways
Right.
with the heart as the central hub,
Okay.
pumping oxygen-rich blood to every corner of your body through those highways.
So the blood vessels are like the roads,
Exactly.
and the blood is like the cars carrying the oxygen.
Perfect analogy.
I'm getting it. Okay, so our sources mentioned a few other terms related to the heart,
Okay.
conduction system, cardiac blood flow, coronary artery circulation, and systemic circulation.
Right. Those are some important concepts.
Can we break those down a bit?
Absolutely. So the conduction system is like the heart's electrical wiring.
Okay.
It coordinates the contractions that pump the blood.
So it's making sure the heart beats in the right rhythm.
Exactly. Think of it as the pacemaker of the heart. Now, cardiac blood flow is the movement of blood within the heart itself.
Oh, so even the heart needs its own blood supply.
It does. The heart muscle needs oxygen just like any other muscle in the body.
That makes sense.
Uh-huh.
Okay, what about coronary artery circulation?
Well, that refers to the specific blood vessels that deliver oxygen to the heart muscle.
Okay, so those are like the dedicated lanes on the highway just for the heart.
Exactly. And finally, systemic circulation is the big picture.
Okay.
It's the flow of blood throughout the entire body,
Got it.
delivering oxygen and nutrients to every nook and cranny.
Okay, so it's this intricate network all working together to keep us oxygenated and alive.
It's a symphony of life.
It really is. But what happens if something goes wrong in this system?
Well, that's when we start to see problems.
Okay.
And there are a number of conditions that can affect both breathing and circulation.
Right.
And it's important to be aware of the warning signs.
Okay, like what kinds of warning signs should we be looking out for?
Well, things like a persistent cough,
Okay.
shortness of breath, chest pain, especially when you breathe,
Right.
these can all be red flags.
Got it.
Those are signs that something might be off with your respiratory system.
And what about fatigue? I feel tired all the time. Could that be related to oxygenation?
It certainly could be.
Okay.
Fatigue, along with the bluish tinge to the skin, doctors call it cyanosis,
Right.
can signal that your body isn't getting enough oxygen.
Okay, so those are some visual cues that something might be wrong.
Exactly.
Are there any other signs we should be aware of?
Well, you should also watch out for things like leg pain or cramps,
Go.
changes in skin color or texture,
Right.
and unexplained swelling.
So basically, if something feels off, it's always best to get it checked out.
Absolutely. Early detection is key when it comes to respiratory and cardiovascular health.
Don't ignore those warning signs.
Wise words.
Yeah. Okay, so let's talk about how doctors actually figure out what's going on.
Right.
Our research mentions something called an arterial blood gas test, or ABG.
Oh, yes, the ABG.
What is that, and why is it so important?
Well, think of it like a snapshot of your blood's chemistry,
Okay.
specifically focusing on oxygen, carbon dioxide, and pH levels.
Okay.
It involves taking a small blood sample from an artery, usually in the wrist,
Okay.
and analyzing it.
And what does that analysis tell us?
Well, it reveals how well your lungs are taking in oxygen,
Okay.
how efficiently your body is removing carbon dioxide,
All right.
and whether your blood is too acidic or alkaline.
Okay, so it gives a really detailed picture of what's happening with your breathing and circulation.
It does. It's a powerful tool for diagnosing and managing a variety of conditions.
Oh, it's like looking under the hood of your car.
Exactly, to see what's running smoothly and what needs attention.
Okay, now let's shift gears a bit and talk about how healthcare professionals, specifically nurses,
Okay.
assess and address breathing problems in patients.
Yeah, right.
Our research dives into what are called nursing diagnoses, but it sounds pretty technical.
Yeah, it can be a bit jargony.
Can you explain it in a way that makes sense for us non-medical folks?
Sure. Think of nursing diagnoses as a way for nurses to pinpoint what's causing a patient's breathing problems
Okay.
and create a targeted care plan.
So it's not just about slapping on a label.
No, not at all.
It's about understanding the root cause and tailoring interventions to each individual.
Exactly.
Okay, that makes sense. Our research highlights 4 key diagnoses:
Okay.
ineffective airway clearance, ineffective breathing pattern, impaired gas exchange, and impaired tissue perfusion.
Those are the big one.
Can we dive into those a bit deeper?
Absolutely. Let's start with ineffective airway clearance.
Okay.
Think of it like a clogged pipe.
Okay.
Something is obstructing the flow of air in and out of the lungs.
Right.
This could be mucus buildup, a foreign object, or even a tumor.
So it's anything that's blocking the airway.
Exactly.
Okay. What about ineffective breathing pattern?
Well, this diagnosis focuses on how well a patient is breathing.
Okay.
Is their breathing shallow or labored? Are they taking in enough air with each breath?
So it's about the quality and efficiency of the breath. Okay. Now, what about impaired gas exchange? That sounds pretty serious.
It is.
What does that mean exactly?
Well, it refers to problems with how well oxygen actually gets from the lungs into the bloodstream.
Okay.
And how efficiently carbon dioxide gets removed.
So it's about the exchange of gases at the level of the lungs.
Precisely.
Okay. And lastly, we have impaired tissue perfusion.
Right.
That sounds like it affects the whole body.
It does.
What's going on there?
This diagnosis goes beyond the lungs and looks at how well blood is circulating throughout the body.
Okay.
If there's poor blood flow tissues and organs don't get enough oxygen and nutrients,
Right.
and that can lead to all sorts of problems.
So it's like a traffic jam on that circulatory highway we were talking about earlier.
Yeah, exactly. Everything gets backed up.
Okay, so those are the 4 main nursing diagnoses related to oxygenation.
Yep, those are the big ones.
And it's amazing how nurses use these diagnoses to really understand what's going on and provide the best possible care for their patients.
It's a testament to their skill and dedication.
It really is.
Yeah.
Now, what about those of us who aren't in the hospital?
Right.
What can we do to boost our own oxygenation and keep those lungs and circulatory systems happy?
Well, there's a lot you can do. And honestly, the most important step is the most obvious: quit smoking.
Yeah, that's a big one.
If you smoke, quitting is the single best thing you can do for your lung health.
There's just no way around it.
Nope.
But what about other things? Say someone already quit smoking. What else can they do to improve their lung function?
Well, even simple things like staying hydrated and using a humidifier can make a big difference.
Ugh.
When you're dehydrated, the mucus in your lungs gets thick and sticky, making it harder to breathe.
Okay.
A humidifier adds moisture to the air, making it easier for your lungs to work.
So it's all about keeping things lubricated.
Exactly.
Now, I've heard that certain breathing exercises can help too.
You're absolutely right. Deep breathing exercises can improve lung capacity and strengthen your respiratory muscles.
So it's like a workout for your lungs.
Exactly. There are a few techniques you can try, like diaphragmatic breathing, also
Yep.
known as belly breathing,
Right.
and pursed lip breathing, which helps control your exhale
Yeah.
and keeps your airways open longer.
So it's about being more mindful of how we breathe.
Exactly. And if you're recovering from surgery or an illness, your doctor might recommend using an incentive spirometer.
Okay.
It's a device that helps you practice deep breathing and keep those lungs expanded.
So there are tools and techniques to help us breathe better.
Absolutely. Now, beyond breathing, you can also boost your circulation with regular exercise.
Right.
Even a brisk walk can make a difference.
Okay.
And speaking of circulation, let's talk about preventing blood from pooling in the veins,
Okay.
especially in the legs. Doctors call this venous stasis,
Okay.
and it can be a real problem, especially for people who sit or stand for long periods.
So what can we do about that?
Well, regular movement is key.
Okay.
Take breaks to walk around, stretch your legs, keep that blood flowing.
Get that blood moving.
Exactly. Compression stockings can also help.
Okay.
They gently squeeze your legs, promoting blood flow back to the heart.
So it's like a hug for your legs.
Kind of. And if you're at risk for blood clots, your doctor might recommend sequential compression devices,
Okay.
which are inflatable sleeves that wrap around your legs and mimic the muscle contractions that help move blood.
So it's like giving your legs a massage.
In a way, yes.
Okay. So we've covered a lot of ground here, from breathing basics to the heart's role, and even some practical tips for improving our own oxygenation.
It's been a whirlwind tour of the respiratory and circulatory systems.
It has. But what happens when those measures aren't enough? What if someone really needs help getting enough oxygen?
That's where oxygen therapy comes in.
Okay, so that's what we're going to be diving into in the next part of our deep dive.
Exactly. We'll explore the different types of oxygen therapy and how they can help people breathe easier.
Sounds fascinating. Can't wait to learn more.
It's going to be a breath of fresh air. It's pretty amazing how we've figured out ways to, help people get the oxygen they need
Yeah.
when their bodies are, struggling a little bit.
Well, let's talk about that.
Yeah.
The different ways that oxygen can be delivered.
Yeah.
Because I know that there are a lot of options.
There are a lot of different ways.
We've got those simple nasal cannulas that I see people walking around with.
Right.
But then you've got those bigger machines too.
You've got the masks,
Yes.
CPAP machines, BiPAP machines.
Right.
Yeah.
So there's a whole spectrum of things.
Yeah, a whole spectrum.
So where do we even begin?
Well, let's start with the most basic and commonly used, the nasal cannula.
Okay.
It's that little tube with the two prongs that go in your nostrils,
Right.
delivering oxygen directly into the nose.
I've definitely seen those a lot.
Yeah.
People in hospitals, people home sometimes.
It's for mild cases.
Okay, so if you just need a little boost.
Exactly, just a little supplemental oxygen.
Is it comfortable?
It is actually. It's very comfortable,
Oh.
easy to use.
Oh.
Allows people to talk and eat and go about their day relatively normally.
So you can still function with it.
Exactly.
Okay, now what about those masks that we were talking about before? The
Right.
simple mask and then the rebreather mask.
Right.
And the non-rebreather mask.
Right. So those masks cover both the nose and mouth,
Okay.
and they're typically used when higher concentrations of oxygen are needed.
Okay.
The simple mask is, well, simple.
Yeah.
It delivers a steady flow of oxygen, but some of it gets mixed with the exhaled air.
Okay, so it's not as pure.
Not quite as pure.
Okay, and then the rebreather mask is a step up from that.
Yes, the rebreather mask has a reservoir bag attached that stores oxygen.
Okay.
Some of the exhaled air gets mixed back into this bag,
Okay.
but it still allows for a higher concentration of oxygen to be delivered
Okay.
compared to a simple mask.
And then the non-rebreather mask, that's the one that I think has those valves.
Yes,
So you're not breathing in your own CO2.
exactly. It has valves that prevent you from rebreathing your exhaled air. Okay.
So it delivers the highest concentration of oxygen possible
Okay.
outside of a ventilator.
Wow. So this is for...
This is for emergency situations or for people with severe breathing problems.
Wow. So it's a whole hierarchy of masks depending on how much oxygen you need.
Exactly. It's a progression.
Okay. Now, what about those high-flow systems like the Venturi mask?
Ah, the Venturi mask.
Yeah.
That one is interesting
Okay.
because it allows for very precise control over the concentration of oxygen delivered.
Okay.
It uses a system of adapters to adjust the flow rate.
So it's almost like a dial.
It is like a dial.
You can fine-tune it.
You can fine-tune it exactly.
And why would you want to do that?
Well, some people need very specific oxygen concentrations to manage their condition.
So it's all about personalization.
Exactly. It's about tailoring the treatment to the individual.
Now let's talk about CPAP and BiPAP machines.
Okay, sure.
Those seem to be more and more common these days.
They are very common, especially for people with sleep apnea.
CPAP stands for Continuous Positive Airway Pressure,
Okay.
and it involves wearing a mask that delivers a constant stream of air pressure
Okay.
to keep the airway open.
So it's like it's holding the airway open.
Exactly. It's like a splint for your airway.
Okay.
It's often used for sleep apnea where the airway collapses during sleep,
Right.
causing pauses in breathing.
So it's preventing those pauses.
Exactly.
Now, what about BiPAP?
BiPAP stands for Bilevel Positive Airway Pressure.
Okay.
And it's similar to CPAP,
Hey.
but it provides two different pressure settings, a higher pressure for inhalation and a lower pressure for exhalation.
Okay, so it's like a two-step.
Exactly, a two-step pressure system.
And why would you need that?
Well, some people need that extra support with both breathing in and breathing out.
So it's a little more nuanced.
It is a bit more nuanced.
Okay, so CPAP is just a constant pressure,
Right, continuous pressure.
and BiPAP changes with each breath.
Exactly. And both can be incredibly effective for managing sleep apnea and other conditions where airway support is needed.
I'm curious, we've got all these different types of oxygen therapy.
Right.
How do doctors decide which one is right for a patient?
Well, it really comes down to a careful assessment of the individual's needs.
Oh,
Factors like the severity of their breathing problem,
Right.
underlying medical conditions,
Okay.
and lifestyle all play a role.
So there's no one-size-fits-all approach.
Definitely not.
Okay.
It's about finding the right tool for the job.
Okay.
And that involves close collaboration between the patient, their doctor, and other healthcare professionals like respiratory therapists.
Okay, so it's a team effort.
It is a team effort.
Okay, so let's shift gears a little bit here.
Okay.
We've been talking a lot about these nursing diagnoses.
Yeah.
We kind of touched on before.
Right.
But I really want to understand, what nurses actually do
Okay.
when they encounter these issues in patients.
So you want to see the theory in action.
Exactly. What does it look like in the real world?
All right, let's take ineffective airway clearance as an example.
Okay.
Remember, that's our clogged pipe scenario.
Right, where something is blocking the flow of air.
Exactly. So let's say a patient has a lot of mucus buildup.
Okay.
What can a nurse do?
Yeah, what do they do?
Well, sometimes the simplest interventions are the most effective.
Okay.
Something as basic as changing the patient's position can make a big difference.
Really?
Oh, yeah. For example, elevating the head of the bed can help open up the airways.
Okay, so using gravity
Using gravity,
to help drain things out.
Exactly. Now, if the patient is producing a lot of mucus, nurses might encourage them to cough effectively
Okay.
or teach them deep breathing exercises to help clear those secretions.
So it's about helping the body do what it naturally does.
Exactly. But sometimes a patient needs a little extra help,
Okay.
and that's where suctioning comes in.
Suctioning. That sounds a little scary.
It's not as scary as it sounds.
Okay.
It involves using a sterile tube to gently remove secretions from the airway. It's a common procedure, and nurses are highly skilled at doing it safely
Okay.
and effectively.
And what about chest physiotherapy?
Yes. Chest PT.
Yeah.
That's another great technique.
Okay.
It involves a variety of techniques, tapping on the chest,
Okay.
vibrating the chest wall, and using specific positions to help drain mucus from the lungs.
So it's like a massage for your lungs.
It is. It helps to loosen and clear those airways.
Okay, so there's a whole arsenal of things that nurses can do to help with ineffective airway clearance.
Absolutely. It's about finding what works best for each patient.
Okay, what about ineffective breathing pattern?
All right, so for ineffective breathing pattern, again, positioning can play a big role.
Okay.
Finding the right position for the patient, whether it's sitting upright,
Okay.
lying on their side, or even propping them up with pillows,
Right.
can optimize lung expansion and make it easier to breathe.
So it's all about those little adjustments.
So those little adjustments can make a big difference.
Okay, and then there are the breathing exercises.
Right, the breathing exercises.
That's talked about before.
Deep breathing, diaphragmatic breathing, pursed lip breathing.
Right.
All of these techniques can help regulate breathing patterns,
Okay.
strengthen respiratory muscles, and improve overall lung function.
And what about that incentive spirometer?
Yes, the incentive spirometer is a great tool.
Okay.
It encourages those deep breaths
Okay.
and helps prevent lung collapse, especially after surgery.
So it's like a little reminder to breathe deeply.
Exactly.
Okay, now what about impaired gas exchange?
All right, so impaired gas exchange, this is a serious one.
Yeah.
Remember, it's about problems with oxygen getting into the bloodstream
Right.
and carbon dioxide getting out.
Okay.
So the primary goal here is to improve that exchange.
Okay.
And often that involves supplemental oxygen therapy.
Right, so those masks and nasal cannulas,
He
machines we were talking about before.
All of those tools can help.
Okay.
But it's not just about putting on a mask and calling it a day. Nurses play a crucial role in monitoring patients who are receiving oxygen therapy,
Yeah.
making sure they're getting the right amount
Okay.
and that it's actually helping.
So they're constantly assessing.
Constantly assessing, making sure that the treatment is effective.
Okay.
And they also keep a close eye on the patient's vital signs, their
Yeah.
breathing patterns, their heart rate, their oxygen levels,
Yeah.
to make sure everything is stable.
So it's about fine-tuning,
Exactly.
making sure everything is working as it should.
It's a dynamic process.
Okay. Now, what about impaired tissue perfusion?
Ah, yes. Impaired tissue perfusion.
This one seems a bit more complex because it's affecting the whole body.
It is a bit more complex.
What do nurses do to help with that?
Well, it depends on the underlying cause,
Okay.
but the overall goal is to restore adequate blood flow to the tissues,
Okay.
making sure they're getting the oxygen and nutrients they need.
So how do they do that?
Well, one strategy is to promote circulation. This might involve encouraging regular movement and exercise,
Okay.
applying warmth to the affected area,
Sure.
elevating the limbs to improve blood flow.
So it's all about getting that blood moving again.
Exactly. And remember we talked about preventing venous stasis?
Right, the blood pooling in
Yeah,
the legs.
Exactly. So nurses might encourage patients to wear compression stockings,
Okay.
use sequential compression devices, those inflatable sleeves that help pump blood back to the heart,
Right.
and make sure patients change positions frequently, especially if they're bedridden.
Okay, so it's all about movement.
Movement is key.
And if the impaired tissue perfusion is related to a heart problem,
Right.
like heart failure, then the interventions might focus on managing that condition.
Okay.
That could involve medications to improve heart function,
Okay.
lifestyle changes to reduce strain on the heart,
Right.
and even surgical procedures in some cases.
So it's really a team effort
It is a team effort.
to address this.
Wow. Okay, so we've really explored these nursing diagnoses in detail.
We have.
And it's impressive how nurses use their knowledge and skills
Yeah, they're amazing.
to really help patients with these challenges.
They are on the front lines of healthcare.
It's like they're detectives,
Yeah.
you know,
I like
piecing together the clues
Yeah.
to figure out what's going on.
They are problem solvers.
And then they come up with these solutions.
Exactly.
Okay, before we wrap up this discussion of oxygen therapy,
Okay.
I want to touch on something that we briefly mentioned earlier,
Sure.
the potential risks and complications.
Okay.
because oxygen is a powerful tool,
It is.
but like any medical treatment.
It's not without its risks.
Right,
No.
exactly. So what are some of the things that we need to be aware of?
Well, one of the key things to understand is that more oxygen isn't always better.
Really?
Yeah, it seems counterintuitive.
It does.
But too much oxygen can actually be harmful.
How so?
Well, it can disrupt the body's natural balance and lead to complications like lung damage, vision problems,
Wow.
and even seizures.
I had no idea.
Yeah, so it's really important to use oxygen exactly as prescribed.
Okay, so follow the doctor's orders.
Absolutely. And that's where nurses play a crucial role again.
Right.
They're trained to monitor patients
Oh.
and make sure they're getting the right amount of oxygen
Uh-huh.
and that they're tolerating it well.
Yeah.
They also educate patients and their families about the safe use of oxygen,
Okay.
emphasizing the importance of things like avoiding open flames and smoking,
Right.
because oxygen is highly flammable.
So safety first.
Safety first always.
Okay, good to know.
Another important aspect is the proper care and maintenance of oxygen equipment,
Right.
whether it's a nasal cannula, a mask, or a machine.
Okay.
It's crucial to keep the equipment clean and functioning properly
Right.
to prevent infections
Okay.
and ensure effective oxygen delivery.
So it's not just about the oxygen itself. It's about the whole ecosystem.
It is about the whole ecosystem of care surrounding oxygen therapy.
Now, speaking of ecosystems,
Yes.
I think it's time that we kind of zoom out a little bit
Okay.
and think about the bigger picture here.
The interconnectedness of it all?
Right. Because we've been talking a lot about the lungs. We've been
Well,
talking about the heart,
The blood vessels.
blood vessels, the nurses,
Oxygen therapy.
the oxygen therapy.
It's all connected.
But it's this synergy between all of them.
It is a beautiful symphony of systems working together.
It's like a beautifully choreographed dance
I love that analogy.
where every part is playing its role.
Yes. Every part is essential.
And, you know, it makes me think that this is actually a really good metaphor for life itself.
How so?
Well, because in life, everything is interconnected too.
That's true.
You know, one system influences another.
Yes.
And even the smallest change can have this ripple effect throughout the whole.
It's a delicate balance.
It is. And so, as we move forward in our deep dive,
Yes.
let's keep that interconnectedness in mind.
Let's keep that big picture in view.
Because it's not just about one organ or one system.
It's about the whole
It's about the whole being.
organism.
Yeah, that interconnectedness is really fascinating.
It is.
And it makes me think about, you know, we were talking about lifestyle choices earlier
Right.
and how, you know, those choices that we make can actually impact our breathing
Oh, absolutely.
and our overall health.
Yeah, we can't underestimate the power of those lifestyle choices.
Right. It's like we're the conductors of our own symphony of health,
I love that.
making sure that all the instruments are in tune and playing together harmoniously.
Like, beautiful.
Now, speaking of harmony,
Yeah.
let's talk a little bit more about this mind-body connection.
Okay.
Because, you know, we were talking about breathing exercises earlier
Right.
and how they can, you know, help regulate our breathing patterns.
Right.
But I've also heard that breath work can actually have a really profound impact on our mental and emotional state.
Oh, absolutely.
So how does that work?
Well, when we're stressed or anxious,
Right.
our breathing tends to become shallow and rapid.
Okay.
And this sends signals to the brain that we're in danger,
Okay.
which triggers that fight or flight response.
Right, right.
But when we consciously slow down our breathing
Okay.
and we take these deep, deliberate breaths,
Yeah.
we're sending a signal to the brain that everything is okay.
Okay.
And that calms down that stress response.
So it's like we can hack our own nervous systems.
We can.
Just by changing the way that we breathe.
Exactly.
Wow. And is there any science to back this up?
Oh, yeah. There's growing evidence
Okay.
that regular practice of deep breathing techniques can have long-term benefits
Okay.
for mental health.
Okay, like what kind of benefits?
Well, it can reduce anxiety, improve mood, and even boost cognitive function.
Wow. So it's really powerful.
It is.
And, you know, it makes you realize that breath is so much more than just air going in and out of our lungs.
Right. It's this vital life force.
It's this connection to our physical and emotional well-being.
Absolutely.
So I think that's a really important takeaway from this deep dive.
It is.
It's not just about the mechanics.
Right.
It's about the whole experience.
Yeah, the holistic view of breathing.
Exactly. Well, I have to say, this has been an amazing deep dive.
It has.
I feel like I've learned so much.
Me too.
And I really appreciate you taking the time
Oh, it's been my pleasure.
to share your expertise with us.
Always happy to talk about breathing.
And I'm sure our listeners have learned a lot as well.
I hope so.
So as we wrap up this deep dive,
Yeah.
what is one final thought?
Okay, let me think.
that you would like to leave our listeners with?
I think the biggest takeaway for me
Yeah,
is that breath is life.
it really is.
It's the first thing we do when we enter this world,
Yeah.
and the last thing we do when we leave it,
And everything in between
and everything in between
connected to it.
is sustained by it.
So I think it's fitting that we end this deep dive
Yes.
with just a moment of breath.
Let's take a deep breath together.
Yeah, everyone listening,
Inhale slowly.
just take a deep breath in
Fill your lungs.
and exhale slowly.
Let go of any tension.
Release any stress
And just be present with your breath,
in this moment.
with the miracle of being alive.
Thank you
Thank you.
for joining us for this deep dive into oxygenation.
It's been a journey.
It has. We hope you learned something new
And we hope you gained
and gained a deeper appreciation.
for the power of breath.
Until next time, keep breathing
Keep learning.
and keep exploring.
Bye, everyone.